successful treatment. So in the hospital, there are a lot of things that we can now still improve upon. But for today, I would like to focus on innovation in the drug reconstitution process. So drug reconstitution is something we all do day in and day out. If I ask any nurses, all nurses would be familiar with this because it's something they do every day, several times a day. And the modern ward and the modern pharmacy's problem is something that has been a persistent problem ever since. So, padami yung pasyente, padami yung drugs na kailangan i-reconstitute, and at the same time, pakonti yung nurses. Okay, so there is an increasing stress levels in the hospitals, and the last thing nurses would need are procedures that would require complex handling and procedures that bring about risk. Okay, so some of these risks that are involved when we talk about drug reconstitution are these. So we have microbial contamination, chemical contamination or drug exposure. We have particle contamination, which Francis discussed earlier, Professor Francis, and needle stick injury, which we all already know, since a lot of drug reconstitution still make use of hollow bore needles. Okay, so aside from these risks, the traditional drug reconstitution with the use of hollow bore needles also requires a lot of handling procedures. So yung pag-aspirate ng air, and then injection of the air to the vial, and then diluting it, and then ulit-ulit, plus nakakangali rin yung paggamit ng needle. And okay, so in light of the risks and in light of the handling inconveniences, in B. Brown, what we intend to do is to innovate on this drug reconstitution process to make it safer and more convenient for the nurse and also for the patient. We would like to do this initially through these main products. We have the EcoFlac Plus 250 and 100 ml, especially to be used for diluting drugs. We have our protective admixture tools, the EcoFlac Connect and the Minispec 2. These are all closed system devices, which I will be explaining further later on. And then, sing it. Within the year, we will be launching the chemo and the filter variants of the Minispec. Pero for now, since ito pa lang yung talagang registered, let's focus on these. Okay, so, beginning with the EcoFlac Plus, the EcoFlac Plus is a closed system IV fluid container with superior drug compatibility. It has a twin cap port system, which is especially useful for drug admixture. So one port may be used specifically for admixture, and the other port may be used for the spiking. So there would be no need anymore to disinfect prior to the access, which lessens the steps required and also increases the safety, since both are separately sealed sterile ports. And then, since the volumes are in 100 and 250 ml, these are ready to be used for diluent, so no more need to drain 1,500 ml IV fluid containers. And then, the material that's used for the EcoFlac Plus also makes it a highly compatible container that may be used even for oncology drugs. Okay? So, next we have the EcoFlac Connect, which is, by definition, a closed system transfer device between an EcoFlac Plus container and a single-dose vial of drug. So, to better explain how this works, the traditional method of drug admixture usually involves these steps. So, it involves aspiration of diluent from the container, injection of the diluent to the vial, and then diluting it, tapos aspirating it again, and then injecting it to the actual container to be infused. Now, in doing this, there is a procedure called the pressure balancing technique. yung pag-aspirate ng air and then pag-inject dahil nga dahil nga it creates a vacuum since closed system yung vial. Now, we do that because one, it makes it easier to actually aspirate the fluid, and second, it prevents the escape of vapor or yung pagsirit ng fluid. But there are times when, for example, the use of whenever we're aspirating toxic drugs, the pressure balancing technique doesn't necessarily assure na walang nakakalabas na vapor, because there would always be an escape in vapor, and this could be dangerous when it comes to oncology drugs, for example, because long-term drug exposure to these kinds of drugs may have detrimental effects to the healthcare worker. Now, in some hospitals, they actually make use of closed system transfer devices already, but these devices a lot of times, yes, they make the process safer, but they don't necessarily make it easier for the healthcare worker, because a lot of times these involve a lot of additional instructions. So what we're offering as B Brown is the EcoFlap Connect, which makes the process safer but also ultimately makes it easier, because instead of this procedure, all they have to do is connect the vial to the container, and then right there and then i-dilute na yung drug. Okay, and then I usually show them the video, but this is something you've already seen a lot of times. So yun, as they see in the video, the handling of the EcoFlap Connect becomes so much easier. So all they have to do is attach the device to the container and then attach the vial